At ELCC 2025, I also presented the results of the SO01 trial, which is a phase 1-2 study with Bayer 2927088, which is an oral tyrosine kinase inhibitor targeting HER2. We know that HER2 mutated non-small cell lung cancer is a specific subset of patients, more frequently never smokers, young patients, and we do not have any standard of care for the management of those patients. At ELCC, I presented some cohorts or expansion cohorts from the SO01 trial. And patients received Bayer 2927088 at a dosing of 20 milligrams twice daily, which was chosen after dose escalation and backfill cohorts. Cohort D was a cohort of patients who were HER2-directed therapy naive. So these patients had previously received chemotherapy for all of them. Some patients, 2/3 of them, had received immune checkpoint inhibitors. 46% of those patients did receive Bayer 2927088 as second-line treatment. In this cohort, we see a high response rate of 72%, together with a disease control rate of 82%, which is obviously very high and shows the potency of this agent to control HER2-mutated non-small cell lung cancer. We have a median duration of treatment of 9.7 months, which is obviously meaningful in the clinic. I also reported the results from cohort E, which is a cohort of patients, heavily pretreated patients. Most of these patients received Bayer 2927088 as fourth-line treatment and beyond, after chemotherapy, after immunotherapy, and after at least one line of antibody-drug conjugate, mostly TDXD. In this cohort, we see a quite high response rate of 35%, disease control rate of 53%, and median duration of treatment of again 9 months, which is unexpected in this context of heavily pretreated patients. So this compound, Bayer 2927088, is highly promising, not only in the late-line setting, but also in the first-line setting. We know in the clinic that targeted agents are more effective when given early in the treatment sequencing, and the SO02 trial is ongoing that compares in a phase 3 trial Bayer 2927088 to standard of care chemotherapy. Well, I think during this ELCC 2025 meeting, we see many new data, many data regarding targeted agents. We have also many studies reporting on the treatment of KRAS mutated non-small cell lung cancer patients. We have new data regarding immune checkpoint inhibitors, especially delivered in a subcutaneous formulation, which is obviously highly promising for the healthcare organization and the patient quality of life. So multidisciplinary discussion, very nice and important meeting for the thoracic oncology community.